When you look at our business, what is our core competency? We are, bringing in truckloads of product of these CGM and pumps. So we're an extension to that DME.
What would you say is some of the biggest misconceptions people have about healthcare distribution?
I think it's important that the products are pharmaceutical products, in my opinion. The diabetes supplies are prescription devices, and the facility that they're being shipped out of has to be extremely clean. It has to be pharmaceutical grade, almost like a manufacturing facility.
In terms of diabetes itself, it seems like it's kind of a strategic growth category that DME companies are looking into. Why would you say that is the case for you guys?
What's starting to happen is it's becoming more accessible for patients to get those products. And what's cool about that is they're opening up the population that can receive these products. It's really cool to see how the industry has evolved in the last 35 years and how it used to look. I mean, you can't start a business in your basement anymore, especially with prescription medical devices.
All right, we are live on the #1 DME podcast, Claim to Fame. Today we have a very special guest, Matt Edwards from Gemcore. Welcome to the show.
Happy to be here, Alex, and thanks for having me, Wayne.
Yep, absolutely welcome.
So before we get kicked off, we always like to give our guests an opportunity to kind of introduce themselves, a little bit about you and a little bit about your company as well.
Sure, yeah. So my name's Matt Edwards. I'm the CEO of Gemcore, and it's a Generation 2 family-owned business. I started in 2006 full-time, but I've been working in this business since the tender age of 8, stapling catalogs in the basement of my parents' house. My mom and dad founded it in 1992, so we've been in business for 34 years. It started out as an over-the-counter mail order catalog, and my dad was an old Revco drugstore executive for logistics, and my mom was a registered nurse, ICU nurse, and there was a Chapter 11 with Revco drugstores, so they decided do you want to move to Rhode Island or do you want to stay here? And he said, hey, I'm going to stay here and I'm going to build my own business. And my mom supported him through that. We spent all this money on advertising. Nothing sold. No toilet paper, no toothbrushes. Diabetes supplies sold. And the reason diabetes supplies sold were twofold. One is there was really no distribution for it back in that time. These are really large devices and they were being sold one at a time. And the second reason is the manufacturers really needed help getting them to patients' hands because a pharmacy was not a good pickup point. It was the doctor's office at that time. So we started the business from there. I've packed a lot of boxes in my life and done a lot of sales and different types of roles here. And it's really cool to see how the industry has evolved in the last 35 years and how it used to look. I mean, you can't start a business in your basement anymore, especially with prescription medical devices. Where it is today, it's incredible to watch the story. So happy to be here and seeing the next generation of what's going to happen with diabetes tech.
Yeah, awesome. Great story. You essentially grew up professionally inside of the GEM organization. Did you always know healthcare would be your path?
Yeah, so I don't know if I had a choice. So I went to Ohio State, got a business degree, came right back up and started on the phones, right? The 90, 100 calls a day, and no one liked me and everyone hung up on me and all that kind of stuff. And then I lived on a plane for quite a few years where I leave Monday, come home Friday. And that's where I learned the most about the DME industry, what people are facing, how are things, set up with reimbursement. That was a big learning thing for me because these business owners were so nice to let me into their businesses and see under the hood of what they're working with. And, outside of that, once I got out of that regional role, national and so on and so forth. So I just love the fact that this industry is so close and, everyone could be competitors but friends at the same time because we're all facing common challenges, especially in diabetes.
That's right.
Yep, absolutely. And that's also kind of a common theme. We've had guests that run some of the state associations and, we've talked about the people, right? The people are one of the best parts of DME. I think everyone agrees, but really you're competitors, but there's definitely like a collective group that advocates and is always happy to help and kind of move the industry forward together. So I love that you said that.
Yeah.
And
we
another
have
common, you go, Matt.
Oh, go ahead, Alex. I'm sorry.
I was just going to say another common theme that we've been seeing throughout the shows as well is family businesses. It's not like everyone just wakes up one day and says, I'm just going to get into DME today. There's usually some sort of family influence or something like that. It seems to be something we've seen on a few of our episodes as well. And what I was going to ask was kind of looking back at some of these lessons that you've learned, being in the family business, going through sales and marketing and operations and everything like that, and even before leadership. What were some of those lessons you learned before becoming even a CEO?
Yeah, so even a couple weeks ago, I went out and started packing boxes because I wanted to see the workflows. And I feel like sometimes you have to understand the process from A to Z in order to make a strategic decision. And so no job's too big, no job's too small. And sometimes there could be layers where things get filtered and really you're sitting there going, well, I see an easy way to do this and it's worth spending money on. Whereas sometimes, employees might say, hey, I don't want to tell Matt I want to spend $20,000 on an upgrade. He's just going to look at me and say, justify it. Well, sometimes if you're at the shipping station and you're looking at how much time it could save, that $20,000 is a drop in the bucket when you're doing thousands and thousands and thousands of these, right? So I feel that open-ended communication from managers is so important. They need to show me sometimes down to a granular level. Another thing I've learned is networking is really important because everyone's got expertise and we all can share information to be stronger partners all together. And probably the biggest thing I've learned is surround yourself with people that are smarter than you and basically I have my strengths, but then I have a lot of weaknesses. And I always try to find talent for my organization that helps with my weaknesses and that turns it into the strengths of an organization.
Love that. And, Gemco itself has built its reputation in diabetes and more specifically in distribution. How dramatically has that market changed since you first entered in the industry?
Yeah, I mean, so I'll take through the whole ecosystem where, we're shipping off paper pick, right? You're getting a pack slip and that's literally what the same pack slip that's going in the patient shipment to today where everything is, automated from a standpoint of it's scanning off screens, you're working through serialized stuff. It's prescription devices now, so there's a lot of regulations on it. Temperature controls, storage controls, humidity controls, security, all that, licensing. So it's gotten more complex as the years have gone on, like a lot more complex, but systems have really helped bring that efficiency with it. And for example, we spent probably 2.5 years looking for some technology for the warehouse that would really take care of small package parcels. There's a lot of automation out there for these large scale or a wrench that doesn't get damaged in the mail and things like that. So, we finally found partners that can actually help us scale the small package things and make sure it's not shaking when it leaves our facility and things like that. So what's really helped with that is the software background, like I know you all are working on. And number two is, I hate to use the word AI because AI is everything, but it's helping drive decisions on what needs to go first, second, third, right? And priorities and things. And it's a lot easier than back in the day when you're paper picking. Or, okay, where's that order in the stack? You can just push it to the front now in the system. So pretty cool to see that stuff. Even though we complain about it all the time, if something bugs out, it's really cool to see when you really think about 20 years ago, it's a whole different world.
For sure. What would you say is some of the biggest misconceptions people have about healthcare distribution?
Well, I think it's important that the products are pharmaceutical products, in my opinion. The diabetes supplies are prescription devices, and the facility that they're being shipped out of has to be extremely clean. It has to be pharmaceutical grade, almost like a manufacturing facility. So we take pride. That's something my dad, preached all the time because he used to work for a lot of pharmaceutical companies. Is it's got to be something you will eat off the floor. You'd eat a steak off the floor if it fell. So a lot of times you hear warehousing and they think, oh, dirt floors, no air conditioning, all that kind of stuff, right? It's really important people know that these products that are going to patients are being taken care of in the highest quality facilities.
It's interesting.
Totally. I was going to ask, in terms of diabetes itself, it seems like it's kind of a strategic growth category that DME companies are looking into. Why would you say that is the case for you guys?
Yeah, so the big thing with diabetes, and this is where we tackle it, is diabetes is in the early innings of baseball as far as CGM technology and insulin pumps. They've been around forever, don't get me wrong, like with test strips, and insulin pumps have been around for a very long time. But what's starting to happen is rapid advancement in the technology, and we're starting to see things like patch pumps. So the pump actually sits on your arm. There's no tube. It's not durable anymore. It's a disposable. And what's starting to happen is it's becoming more accessible for patients to get those products. And what's cool about that is they're opening up the population that can receive these products. So typically you need to be a type 1 patient, insulin dependent, having to, critical diabetes needs. You're going low in the middle of the night. You're going into a coma, right? These are the people that are typically candidates for an insulin pump. Now they're showing in studies that type 2 patients, anyone who's just riding high all the time, are having significant benefits from the connectivity of CGM and pumps, as well as better A1Cs means better outcomes, means that payers' HEDIS scores get better. So what we're seeing now is payers are opening up access to, or I should say not access, opening up eligibility for more patients to get the products. And so we look at that as the universe for type 1 is a very, very small, 10, 12% compared to the rest of the market. And every year we're seeing a new bucket opening. And as policies change in these payers, there'll be more opportunities. And then the second thing, and I'm sorry it's taking so long here, but the second thing is that the pharmacy space is really getting into this market now. And pharmacies are carrying CGMs. They're starting to carry the patch pumps. And so even though there's the DME, if you have a pharmacy, there's opportunities. Some of the DME partners that we work with have pharmacies or they're hybrid. There's a lot of access now in the pharmacy space as well. And that's really accelerating some of the benefits beneficiaries can get.
That's really interesting. Are there any other trends that you're watching closely in the space?
There's quite a few. Again, the pharmacy and DME and where does the product live with the payer, right? It can be, usually it's both. We always advocate for both. Home care and being on the diabetes council, we want dual channel so that if a patient leaves the doctor's office, I don't know where to go or I don't know where to pick this up. And the patient, one size doesn't fit all, right? A patient might need that ongoing care from a DME or they just want to pick something up at the pharmacy counter with their other drugs. It's up to the patient and the doctor and how they want to do that channel. So what I get concerned about sometimes is payers will say pharmacy only or DME only, or they're cutting access off, and that causes confusion. So CMS competitive bidding's coming in June 4th, or June 4th it came out the FAQs, and then around 2028 was being talked about with CGMs and insulin pumps combined. And there's some concerns from the Home Care, Diabetes Council. There's going to be access issues. Insulin pumps are a very interesting category when it comes to turning them into a rental model versus a buy model, or a short-term rental to own. So we have some policy making we need to do and some suggestions we need to send to CMS and obviously try to get some changes because we're just overly concerned about what could happen on access.
Yeah, for sure. And you guys, obviously partner with hundreds, if not thousands of DME providers across the country. How has the role of distribution evolved beyond simply moving products? Is it advocating on behalf of them or any thoughts from that perspective?
Yeah, so I think when you look at our business, what is our core competency? We are, bringing in truckloads of product of these CGM and pumps. Truckloads are coming into our facilities and little patient shipments are leaving, small package patient shipments are leaving our facilities. And it looks like it's coming from the DME. So we're an extension to that DME. It says ABC Medical. It's got their packing slip in there. It might have marketing literature and all that stuff, right? So we are maybe one of the touch points that DME has. On top of that, we're really seeing a lot of need for help, need for understanding. We can't interpret policies. We're not lawyers, but we can at least guide people to, back to my network point, hey, you're having issues with this, go to this company. Hey, you're having issues with this, go to this person. This consultant can do this for you. There's so many networks that we have where we have a called like the spider web, that if it's something we can't answer, which is like a basic question on Medicare billing or where to go for the LCD or things, there's a tons of industry colleagues that we make sure that we connect people with. And a lot of the times, if you're a small DME in the middle of, Texas, for example, you might not know, going to these trade shows and things like that, what resources are available. So we might not have all the answers, but we make sure that we can find those answers for people.
Got it. Yeah.
Totally.
It's not just a distributor, but also a resource for surrounding aspects of the products.
I wanted to jump into CGMs. They've kind of become one of the bigger growth drivers in DME. Why do you think adoption accelerated so quickly?
Well, we're living a world of data, and here I am with my, my Apple Watch, and it's addicting when you get to a point where you want to see how you slept, you want to see what your blood oxygen is. I mean, you can do all sorts of stuff with these watches, and your phone's telling you how many steps you're taking, and we're in a connected world now. And blood glucose back in the day was a finger prick. You looked at it in the morning, you were, oh, I'm good. You could be all over the place all day. And then, towards the end of the day, you might be spiking and you didn't even know it because you took, points in time. You wear a CGM for a day or two and you have blood glucose issues, you really see what's causing it quickly. And if you're insulin dependent and things, it's really giving you an idea of, how much you dosed and how that affected you. And really at the end of the day, if you're tired at 2:00 in the afternoon and you had a big lunch, and you're all of a sudden tired, yeah, that's your insulin coming into your body and closing you down. So not just the prescription CGMs, we're seeing people using them now in lifestyle with the OTC products that, Abbott and Dexcom have, where people are just using them so they can train better. They're using them for, why am I tired at 3:00? Is pizza killing me, or is it something else? Is alcohol bringing me down? Things like that. So it's basically a life-sustaining device on the prescription side, but we're starting to see the connected health more acceptable. And it's a badge, right? You're wearing this, but everyone's wearing one. There's a lot of people wearing one. I wore one for weeks and weeks and weeks, and it's really great data. And I don't think people are sitting there going, oh, they have a CGM on anymore. It's really socially acceptable at this point because everyone's wearing connected stuff.
Yeah, for sure.
I was
It's
just
really
curious,
interesting.
real quick on that.
Go ahead, Alex.
Yeah, because I've seen people wear those, and as a person who like, let's say, doesn't have any sort of insulin issues, what kind of data are you getting as, like, let's say, just a average guy? Anything that can actually tell you, inform you about what you should do about your lifestyle? I'm just curious.
Yeah, so the over-the-counter cash products, they don't tell you if you're going hypoglycemic. You're going urgent low, blood glucose crash, you need to get, intervention. It doesn't really tell you how high you are either, right? It just tells you kind of where you are in range. And it can be kind of boring as a non-diabetic to wear one because you're kind of in range all the time, which is what your body's supposed to be doing. But what you really don't realize is that there's certain foods that affect people, and then you're spiking. You'll see people with stress, sleep, hydration. Those things all affect your blood glucose, and it might not be you're at 250, which is where a diabetes patient might be if they're not controlling it. You might be at like 140 or 130, and that's high to be living at that level, or 120 pre-diabetes, right? So what it really does is help you dial into how do you keep yourself at 100 and below, and what's causing it to go above. And
Right, so you can see what foods might trigger that higher number, right, and try to maybe stay away from them or in moderation.
All sorts of things, yeah.
Yeah, Matt, I think you said early on we're kind of still in the beginning stages of the early innings when it comes to diabetes technology adoption. From your lens, what does the next generation of diabetic care look like?
I think the insulin pump manufacturers are doing a good job of making smaller form factors for patients. I don't know if you've ever seen an insulin pump. They're heavy and they could be big, but they're not huge. But they're just, if for a 9-year-old patient to wear something that's, they have to wear it somewhere. They've all started, now the pumps are a lot smaller. They look like iPhones. You can control them from your iPhone. I mean, there's so many cool things that they've done lately with these products. If you look at the pumps back in the day, they were, they're just bigger. The patch pumps are really becoming a big thing. We see every manufacturer now working towards or have one where you're just wearing it on your arm. Now the CGM side, right? Dexcom just announced their G8. Libre's got a lot of cool new tech with the connected health. Everything's going to be interconnected and at one point just be automated. It's going to tell you when you're high, low, and it's going to automatically dose you. That's what it does now, right? They have algorithms, AI algorithms, and these AI algorithms are learning your body and what the carb doses are that are affecting and how much you have to come down or how much insulin to give. So that's all going to get better with the algorithms on the software side. A lot of these insulin pumps, it's just a device, and the software is what's getting upgraded every year. The firmware, just kind of like a Tesla, right? A Tesla back in the day. Now they have, there's new self-driving. They just send something to your car, right?
Yep.
Yeah, that's the same thing these pumps are doing now. They're doing software updates. That's a huge technology upgrade. So smaller form factors, more AI algorithms, just easier to use, and not as much of a barrier to educate and learn how to use. They're starting to really take out all the guesswork of the patient having to figure out everything. It's just learning you, and as you wear it, it's self-learning. Pretty cool.
Yeah, software is definitely a growing aspect in healthcare. We actually just had a guest on yesterday. They do virtual reality headsets for pain management is one of the categories, and similar concept. The product can stay the same, but they can keep enhancing the software and what the patient is visualizing and how they're delivering care without even changing the device. So similar, same vein. It's interesting for sure.
And
there's a lot of different ways there's a lot of different brands out there too, and not a one size fits all, right? There's different needs for different people, so it's good that they have choice.
Absolutely.
For sure. And going off that, I was curious, where do you see like the DME industry heading in the next few years, let's say 5 years from now? I know everyone that we bring on the show, typically we do like to ask that question. Everyone has kind of a different vision. I'm curious where you think this is going.
Yeah, I think as a DME, you really have to be prepared to automate a lot of things using software to your advantage. I think the biggest thing with DME today is it's still a lot of facts and paperwork driven, and it's antiquated. I look at the pharmacy, right? The pharmacy market. Everything is done up front. Bing, bang, got it. Prior auth automatically sent. You can see someone's coverage, eligibility right there up front. You get a valid prescription and you can get everything on the patient's demographics, right? You go to the DME industry, there's 65 steps to do that same thing where there's automated switches and all that fun stuff. So I think in the next 5 years, DME will catch up with the right software partners, with some of the ways the pharmacy market works with network switches, AI capabilities, eligibility connections. It's all about the API connectivity because not everyone has every solution, but it'd be really nice to tell a patient, hey, this is your coverage on the pharmacy. This is your coverage on the DME. Which way would you like to go? Or, hey, waiting for the doctor's office would really be nice to show them where they're at. I call it the Papa John's pizza tracker, being able to show them where they are in the steps, right? It's just better patient experience. And with all the API connectivities, they could say, hey, your Nico order is, Gemco just shipped it 10 minutes ago, right? That's the kind of visibility we're getting to. And that's what's really cool about the next 5 years. A DME shouldn't be just this back office paperwork company anymore. It should really be an automated solution and catch up to some of these cool pharmacy switches and back ends that they have.
For sure, yeah. Exciting times ahead. Good is always a headwind, but a lot of innovation comes with it. So, kind of going off of what you just mentioned, your company kind of sits in a unique position, right? Because you guys work closely with manufacturers, providers, payers, patients, and it leads me to think you guys kind of have a vantage point to maybe see things others don't. Are there any trends that are interesting that might be overlooked right now, or anything kind of unique that you're seeing from your side?
That's a good question, Wayne. I think of the diabetes industry right now. You've got to be able to show that you can do both the DME, pharmacy, you have a good logistics partner, You have to show that you can get things out quickly. People expect things instantly now, right? With the whole Amazon 2-hour delivery, right? So bigger, faster, stronger is something that you have to adapt to. And I think trend wise, the people who have the best visibility for patients to see what's going on and have the quickest way for them to get the product, as well as visibility on what they're going to pay for it, are going to win long term.
For sure. Kind of a funky question, but if you were to start a DME today, where would you focus?
Like what category would I focus on? Or
Sure.
Diabetes. I don't know anything else. I live in a little corner. It's funny because the diabetes business is all I'm just a kid from Akron trying to, distribute diabetes devices is what I always tell people. The big thing for us is diabetes is a hypergrowth category. The reason is it's showing benefit to payers. They're getting the results they want when people are on therapy and compliant. So they're saving money on their other spend, hospitalization and complications from chronic disease, right? So I still think as long as you have a good payer strategy, you can show value. It's not just about the widget, it's about the solution of how compliant they are and staying on therapy, and you can brag about that. I think it's a great, viable industry. And you go to MedTrade or some of these big shows, and diabetes was never talked about back in the day, and it came forefront here in the last couple of years as we saw technology really advance with CGM. So I'm pretty excited about opening up access to more patients. I'm not excited about bidding in some of the category changes with rental model, the FSS model, and things. We got some work to do there. But at the end of the day, I think our largest opportunity is still to serve more patients and show better outcomes to payers across the country.
I got a question on this on a new trend. So obviously you hear a lot about these new peptides, GLP-1s, and all these things that are making people drop weight drastically, which obviously would probably lead to less like type 2 diabetes and things like that. Do you see that impacting your industry at all?
Yeah, it could. I'm not a doctor or a medical doctor, but what I can tell you is that there's still the penetration in type 2 is, I think it's under 10%. There's some slides on it, so I don't have them in front of me, but it's way low. And so let's just say 50% reduction in type 2 incidences. That's great for the healthcare system, but there's still 40% of the market that hasn't even seen this product, and that's a big part of the business. I mean, a majority of the growth we've seen in this business has been insulin dependent patients, and now we're talking non-insulin dependent patients. It's still a large pie. So does it affect, does weight loss help? Yeah, but so does you have to still diet, you need to exercise, you still need to do those things. You can't just eat Doritos all day and drink Coca-Cola, and you gotta stay healthy, right? You gotta keep your metabolic conditions up. So I think as they become more mainstream, there's still a lot of growth, but I could see type 2 going down over time with GLP-1s.
Interesting. Yeah, I feel like that just peptides and everything's all everywhere you turn.
Big
so
fat, yeah.
Question. But
Is that prescription product? Is that a prescription product? Peptides, I haven't really looked into them too much.
I guess
I think some of them are. Yeah, it depends on which
like
kinds.
Ozempic and I don't know.
A doctor, yeah, a doctor would have to give
either.
that to you, yeah. But there are a ton. I mean, anyone that you see that's like a little shady is like selling peptides now. So I don't know where they make them or how they get them or what part of China they're getting them from, but it doesn't seem like something that is well, researched totally yet. It's a gray area.
We used to have a compounding pharmacy back in the day, and it was for animals. Like we've actually tranquilized Shamu at SeaWorld. That was one of our projects. Like actually, the Shamu at SeaWorld had to get moved, and we gave them the tranquilizer for it. So
That's
we had
crazy.
a compounding pharmacy.
That's
so
your claim to fame right there. If not,
there it is. Yeah. So
that will be
the
trailer.
Tranquilized Shamu like 20 years ago. No, but the point is the PCAB or the whole accreditation to be sterile compounder is pretty rigorous, and we didn't want to do any human because it is extremely hard to keep bacteria out and all those things. And if people are just making this stuff out of their home or, out of a random place and they're not getting oversight, I would stay way far away from it. You got to go find a compounder that's manufactured, and the compounder needs to have oversight from FDA. I just warn everybody about not using some back office pharmacy out of nowhere that this, compounds them. It just is.
Totally.
It's just not safe unless they've got the accreditations.
Yeah, I mean, there's like factories in China that are marketing it on like Instagram, that they can sell you the powders and then they can sell you the liquid separately, and you can mix it yourself and inject yourself, and it just, something about it doesn't seem quite right.
Stay away. Stay away.
Yeah, right.
Matt, a couple more questions. Gemcore as a whole talks a lot about partnerships and outcomes. Just generally speaking, how do you build long-term relationships in healthcare?
You have to trust each other, and everyone has a role in the industry, and we're all in it together. And the strongest things that help us as Gemcore is the relationships we have. The relationships we have with manufacturers, the relationships we have with DMEs, patients, payers. I mean, they're all in this ecosystem, and even software vendors like you all. I mean, it's really important that we collaborate and stay together versus trying to do everything on our own. The biggest example is, and I just got the chair role at A Home Care for the Diabetes Council, right in time for competitive bidding. Thanks, Linda Landry.
No pressure, no pressure.
Thank you. No, but we all came together and solved common problems, and no one's sitting there going, "Oh, you stole somebody from me," or whatever, that kind of stuff. It's more, hey, let's get our heads together and solve these problems, because there'll be no business if we don't figure out how to keep it sustainable. So everyone to me is a friend. Everyone in this industry with good intentions, I want to make sure that I have a network with. That's really important to me, and that's what keeps you going. Because then all of a sudden you have an opportunity come out of nowhere. That's really what happens. That's how you grow your business. Opportunities come out of nowhere because good people mix with good people.
Love it.
Totally.
Love it.
It seems to be something we kind of hear pretty often on the show, right? Is that it's all about the community, it's all about the people, and the people are really what holds this whole industry together. Going off of that, I did want to ask one final question before we move on to the rapid fire round. What's one piece of advice that you give to like younger healthcare leaders in the space?
So if I'm a younger healthcare leader, get disciplined with data now and understand dashboards, how to do some programming light with AI and things, because sometimes some of your best business decisions come from what the data is telling you versus the feeling. And then I'm going to go with, if you're a young professional right now, it's really important you network face-to-face and learn who's in the industry. And if someone's willing to talk to you, talk to them, learn from them, because their 30 years in the industry is invaluable. There's nothing you can learn in a book that person has so much more experience than something you read in a book. So data, learn how you want to have your data presented early age. And then networking, I'll go back to it. Try to find as many leaders that will talk back to you and try to learn from them and attach yourself to them.
Awesome. Love it, Matt. Now it's time for our famous rapid fire section. Really easy, no pressure, just a fun, easy this or that. Are you ready?
Yep.
CGMs or insulin pumps?
Insulin pumps.
Most overrated healthcare buzzword?
Oh. Workflow.
Cleveland Browns or Ohio State football?
The Ohio State.
The most used app on your phone?
Ooh. Right now, probably Game Changer.
If you were
actually, it would be probably Microsoft Outlook during.
Yeah. If you weren't
but
in
personal
healthcare,
life, it'd be Game Changer.
If you weren't in healthcare, what would you be doing? You got to think before you're 8 years old.
If I wasn't in healthcare, what would I be doing? Probably selling something.
Right on.
Don't know what. Don't know what.
You can sell software with us.
Yeah, I mean, probably selling because I just like talking to people. So just don't know what product it would be.
If Gemcore had a mascot, what would it be?
Oh, it's Superman.
Oh, I remember that from your office.
Awesome.
Last
Love
one,
that.
favorite family tradition?
Ooh, favorite family tradition. Well, Christmas Eve for us is when we all get together on my side of the family. So that's been going on since, geez, I was born. Obviously, it was always the big party, everything, 100 people over, whatever. Was always Christmas Eve. Christmas Day wasn't even a thing. It was just,
Love that.
Me, my mom, my dad, maybe my two brothers. We wouldn't even open gifts. Like everything was done on Christmas Eve, and I don't know.
Awesome.
It's been always really fun for us. And that's one of the days that we were open like 361 days a year. I mean, it's we're always open. Even when you don't think we're open, we're probably open. It's like the one day that we take off that maybe UPS is still shipping or something, right? So it just means a lot to us that day.
Awesome. Well, that was. We'll leave it. That will make that the last one. That was awesome, Matt. Thanks for sharing.
Yeah, Matt. Well, thanks so much for joining today. This has been a really great episode. Hopefully we can have you back on. And if any of our listeners want to get in contact with you or find out more about your company, what's the best way for someone to do that?
Just email me at medwards@gemcorehealth.com. And easiest way for me is to reply back to you and see if I can help.
Awesome. Thanks so much for joining. This is awesome. A lot of fun.
Yep. Thanks again.
Thanks
Matt.
for having me.
Have a
That was stressful and fun at the same time.
Well, it's not so bad.
No, it wasn't
Thanks so much, man. All right.